Okay, so we're going to look at acupuncture as a neurologically based therapy, and the first thing we'll consider is acupuncture points. Now, acupuncture points are located all over the body, and they're lined up in channels, what we call meridians in traditional Chinese medicine. And research has shown that these points line up with the course of peripheral nerves, and in fact the meridians follow the course of the peripheral nerves quite closely. So we're going to review a little bit here what happens when we stick an acupuncture needle into an acupuncture point on a meridian, and also what can be done with electrical stimulation over these same points. So if you wanted to demonstrate some evidence linking the peripheral nervous system with acupuncture point stimulation, one method would be to do a nerve block of a peripheral nerve and then stimulate acupuncture points that are located within the field of that particular nerve. And this was done by Chang et al. In 1973, where they did a nerve block, peripheral nerve block, stimulated acupuncture points, and found that the nerve block completely abolished any effect of point stimulation within that field. Now, if they put needles in points outside that nerve field, there was some evidence of acupuncture effectiveness. So this is pretty direct evidence that if the nervous system is not intact, the effects of acupuncture will be diminished or abolished. So we're going to talk a little bit now about what we call the local effect of stimulation of an acupuncture point, be it with a needle or electrical stim or some other form of stimulation. But before we get into what happens in the situation of the tissue locally, I want to describe to you what's called the axon reflex. When we think of neurological reflexes, we usually think of an afferent branch, an integration, a synapse, and then an efferent response. But with the axon reflex, there's only an afferent portion of this, or arm of this reflex. And what it entails is stimulation of a sensory nerve, usually a C fiber in the periphery and free nerve ending. An impulse is generated and travels towards the dorsal root ganglion, and it's reflected back and travels anadromically back towards the free nerve ending. When it reaches the receptor, the free nerve ending, it causes a release of neuropeptides locally, and this produces a flare reaction, almost like when you get a bee bite or a bee sting, where you get swelling and redness and a slight inflammatory response. This is known as an axon reflex. Now, research has shown that you can elicit this reflex with the TENS unit, and the optimal stimulation frequency is 5 Hz. Above 5 Hz stimulates more of A delta fibers, which, as we'll discuss if we haven't already, that is one of the pathways in which we believe acupuncture works as far as needle insertion. So the axon reflex can be elicited through a TENS unit at 5 Hz, and it causes a local release of neuropeptides at the site of stimulation. So for those of you who have never done needle acupuncture, what we look for often is we find a point that we wish to stimulate, and we'll insert a needle, and what we look for and what we like to see is a red ring, almost an erythema, developing around the needle. And this is a result of stimulation of the axon reflex and a release of chemicals at the site of stimulation. And this can be applied. There's a technique called surrounding the dragon that works quite well on skin lesions, where you actually put needles and enclose the lesion in a circle of needles. The technique is called surrounding the dragon in traditional Chinese medicine. And what this does is causes a lot of vasodilation, which allows immune system cells to get into the area, increases circulation and nutrition, and eliminates waste products. And that is all from the basis of the axon reflex. An interesting phenomenon that has been reported repeatedly, and I've seen this in my own office. And this slide shows the location of large intestine 4. It's a common acupuncture point used. It's located between the thumb and the index finger and the web of the hand there. You can see the point location on the diagram, and then there's a meter with a hand in it, which happens to be my hand. And if you notice the dial on the meter, there is a decreased electrical resistance over acupuncture points. that's been studied and reported on in numerous publications. And what that means is if you put the meter on a non-acupuncture point, there's no flow of current through the skin because the skin is an insulator and inhibits current flow. But at points on acupuncture points, in areas of acupuncture points on the skin, the electrical resistance in that area is reduced, and you'll get a current flow which you can measure on the meter. So this is kind of a fascinating characteristic of acupuncture points, that they have decreased electrical resistance, and so they're actually amenable to electrical stimulation on the surface because there's less insulation, or it's almost like a channel from the exterior into the body, and as we know from what we discussed, to the nervous system through these acupuncture points. So we talked a little bit about what happens locally in the tissues when a nerve is stimulated through an acupuncture needle or through a TENS unit in terms of the local neurotransmitter release. But what happens also, there's a segmental stimulation that occurs. And segmental meaning we are chiropractors, you can think of dermatomes and peripheral nerves and dermatoma levels. So if I stimulate a point in the periphery, I'm going to get the local response, but I'm also going to send a signal up a peripheral nerve to that segment of the spinal cord related to the area where the point is located. This is called segmental stimulation and a segmental effect. Now let's take a look at this illustration to show what we're trying to demonstrate here. If you look at the figure in the lower left-hand side of the slide here, you'll see acupuncture points being inserted into a neuropathy patient's foot at the base of the toes, between the toes, and locally at the distal part of the foot here. The tibial nerve makes up is derived from the L4 to S2 nerve roots, and it works its way down the leg and the medial malleolus, and right above the medial malleolus and a little bit posterior is the acupuncture point spleen 6 or SP6. Now this would be an illustration of a segmental point along a dermatome here. You have your local points where we see the needles, and then a little bit higher up the leg we can put a stimulation, we can put a needle in. In this case we are showing a TENS application. Now similarly, on the opposite side below the knee, on the lateral aspect of the leg, is stomach 36 acupuncture point, or ST36. That is related to the common peroneal nerve, which also derives from L4 to S2. So we can stimulate locally at the foot with needles. We can stimulate on the nerves that are related to the part being treated. In this case, the dermatomes L4 to S2, or the peripheral nerves, the peroneal nerve and or the tibial nerve. So here's a graphic illustration of what we've been talking about. You have C fibers that are carrying pain sensations. For our example, let's say from the feet in a patient with neuropathy. That's entering the dorsal horn of the spinal cord and being distributed up through the spinothalamic tracts to the higher centers of the brain, being interpreted as painful sensations in the feet. Then we put a needle in an acupuncture point, which corresponds to a peripheral nerve, and there's a preferential stimulation of the A delta pain fibers, which are slightly myelinated. They go to the dorsal horn where they synapse with an interneuron, which is inhibitory, and it suppresses the activity of the substantia gelatinosa, which is the pain processing, the early pain processing part of the dorsal horn, thus causing a segmental block in pain transmission. Now what's interesting about the A delta fibers is they also respond to warmth or heat. Thus they can be, if you've seen video or pictures of people getting moxa, which is burning an herb on the end of the acupuncture needle to add heat, it should in theory enhance the transmission through the A delta pain fibers. Also near-infrared laser can do this, so sometimes we'll do what we call red needle acupuncture, where we put the acupuncture needles in the person and then shine a near-infrared laser on the needle to try and augment or synergistically activate the A delta fibers for the purpose of suppressing the C fiber transmission. Okay, so we've discussed the local effects of applying acupuncture on neurotransmitter neuropeptide release locally at the nerve ending, and we've discussed a little bit about what happens, the integration at the spinal cord level and the analgesia that's produced at the dorsal horn, in particular the substantia gelatinosa. Now we're going to discuss more of a top-down approach to acupuncture, dealing with the cortex and the brainstem and how that sends signals down, and you'll see that it interfaces again in the dorsal horn to produce an analgesic effect. Now there are a number of studies that have been published, usually mainly functional MRI, which show the brain's response to the insertion of a needle in an acupuncture point. And what's interesting is in these studies there are common areas of the brain that are stimulated. So if I put a needle in an acupuncture point and put a needle in a non-acupuncture point, there's going to be some overlap in the reaction of the brain to that stimulation. The fascinating idea or concept or finding is that when you stimulate certain acupuncture points, you get very specific activation of brain areas that do not typically occur with other sites of stimulation, either other acupuncture points or other non-acupuncture points. So the take-home message of this, if you look at the representation of the brain at the left, that's before acupuncture stimulation, and then we look at the representation of the brain on the right, you can see different areas of it that are they have bold signal increases, which means increased blood supply that's measurable by functional MRI. You see that the acupuncture points have specific areas that they can light up, and this is very useful if you know this information from a neurological perspective. If you want to stimulate specific parts of the brain that may be dysfunctional in neuropathy or other neurological illnesses, you can use this neurological or neuroanatomical selection of acupuncture points to stimulate specific parts of the brain that have been studied through functional MRI imaging. Two very commonly used acupuncture points: large intestine 4, which is on the web of the hand between the thumb and the index finger, and gallbladder 34, which is very close to stomach 36 on the between the tibia and fibula at the common peroneal nerve, have been studied for their central effects. And using a functional MRI, Li4 has been shown to modulate activity in the PAG and the hippocampus, while stimulation of gallbladder 34 increases fMRI signals in the hypothalamus and primary sensory motor cortex. So these are points that we like to use a lot, and as we're talking about central stimulation and central top-down acupuncture analgesia. So you're going to use your local points on the feet, you're going to use your segmental points in the dermatomal areas and the peripheral nerve areas. Then you can use points that seemingly are completely unrelated to symptoms in the feet, where you put the needle in the peroneal nerve at the knee and at the web of the thumb and index finger on the hand. And this is for the purpose of stimulating top-down analgesia, which is synergistic with the segmental and local effects of acupuncture analgesia. Okay, let's take a quick look at this graphic to review some of the mechanisms of acupuncture analgesia. Number one, you have the local effect, where you put a needle or stimulate a nerve ending at an acupuncture point and you get a local release of neuropeptides, including calcitonin, gene-related peptide, and some other ones. Then as the nerve is stimulated through the needle or the stimulation in the periphery, it goes into the dorsal horn, the substantia nigra, and there are two competing nerves that are preferentially stimulated when you insert an acupuncture needle. One is a smaller C fiber, which is unmyelinated. The other one is an A delta fiber, which is slightly myelinated. The A delta fiber, through an interneuron, suppresses the activity of the C fiber. This is known as the segmental effect of acupuncture analgesia. Now the A fibers and some of the C fiber signals continue up to the brain, where they activate the PAG and certain other serotonin-driven descending pain inhibitory pathways. This is the central effect or extra segmental effect. These pathways descend, they synapse in the same dorsal horn region as the activity of the segmental analgesia. They cause an extra or added release of enkephalon, which in turn suppresses C fiber activity even more. And then you have this other, a little bit more nebulous limbic type depression of pain behavior that is stimulated by acupuncture. So you can see there's a complex and powerful wide network of analgesia that's produced by stimulation of acupuncture points on the body.